Hi everyone. We're here with our brilliant women's health physio, Ali. She's been a women's health physio for over 10 years, and she is the brilliant mind behind all of our programs. And it's so great to have you here, Al, just to talk about some of the things that women experience early postpartum and I guess some of the things you wish all your patients knew. And yeah. So I guess to get started, what is our early postpartum period? Can you let us know? What does that mean?
Yes, thanks, Amy. So our early postpartum period, we're normally, in that first sort of 6 to 8 window, 6 to 8 week window postpartum, often called that sort of fourth trimester, which is a really important time for healing. And there's a lot more that we can do and educate all of our patients on regarding this really important window.
Yeah, awesome. And I suppose, every woman has a different birth story. Is there much of a difference between someone who's had a vaginal delivery versus cesarean?
Yeah, definitely. Of course, obviously, cesarean, a bit slower in that sort of first 4 to 6 weeks. And we have like different precautions that we're a little bit more mindful of compared to vaginal. But in saying that, obviously, vaginal comes with its own sort of set of circumstances that can happen depending on any birth injuries that,
Mm.
during your pushing period and during the actual birth itself. But sort of similar for a lot of things that we'll touch on. And then, there's obviously a lot more that we can go into with our C sections as well.
Yeah, great. And is there anything or any nuggets of wisdom that you wish your patients knew before they were discharged from hospital? So in those first really early days.
Yeah, definitely. That's a really good question. I often see a lot of patients, sort of 4 to 6 weeks after being discharged. And there's things that, I definitely wish that I knew. One of them being to take your stool softeners is really important. They often were either get given them, when they're discharged and not sure, if you're meant to keep taking them, do you take them for a few days? Sometimes they don't get sent home with them, which is a little bit frustrating. But and then really important for our sort of managing constipation, which seems like a small issue compared to everything else going on. But
Yeah.
it's definitely one of our more important things we want to get on top of in that first 6 weeks to prevent a lot of other things from worsening or higher risk of prolapse and things like that that we can talk about.
Yeah, okay, wow. And I guess talking about prolapse and other symptoms, what sort of physical changes and symptoms or sensations can we expect in the first few days or weeks that are normal? I know from experience, often those feelings can feel really strange and foreign, and it's hard to know, I guess,
Yeah.
what's normal and what you need to sort of seek more advice for. So, yeah, what can we expect in those first few weeks?
Yeah, no, great question. It's sort of that, like, what's normal versus common, and often because things are so common, we think that they must be normal, especially in that early
Mm.
postpartum window. But just because everyone has them doesn't mean that it's something that you need to put up with or that it is in that normal category. I think a big one that's probably actually more normal in that first, I want to say at least maybe first 3 weeks would be that sort of pelvic floor heaviness
Mm.
that everyone, it can be really stressful early on. But if it goes past that sort of 3, 4 weeks, then that's when, it's definitely in that sort of not normal, common but not normal basket. A very small amount of leakage, with sneezing, laughing, coughing, and that same thing that first few weeks is normal. Everything's adjusting, our coordination, our pelvic floor reflexes that often we've taken for granted before.
Mm.
Um, that can be sort of normal, but same thing, if it doesn't change, then I would say that that's, something that really needs to be addressed.
Yeah.
Um, and probably another one is that it's really common is that bladder urgency that can happen
Yeah.
postpartum. And same thing, it's normal in that first really small window, first 1 to 2 weeks, if it's mild and not too bothersome. But yeah, if it goes beyond that and it's obviously affecting your day to day, definitely something to, yeah, see someone about as well.
Yeah, yeah. And I suppose when we're talking about that pelvic floor heaviness, is that that kind of feeling where it feels like you stand up and your organs are about to fall out through your bottom? Is that that kind of
Yep.
feeling?
Yeah. Yeah. So it's like that, yeah, it can feel, yeah, just like you don't have that same support there.
Yeah.
When, especially through a vaginal birth, the levator hiatus, so it's that where our pelvic floor attaches on our pubic bone, stretches to about sort of 3 times or up to 3 times of what its normal resting sort of
Wow.
circumference is. And that, yeah, is a scary,
Mm.
scary image. And then that first 3 weeks is a really important sort of window of that coming back to its sort of size that it was before. So you can imagine the sort of heavy symptoms that come with that. But if there's obviously like like a bulge at the entrance of the vagina that wasn't there before, um, with that heaviness, then I would say that's more on the verge of, yeah, not normal. And also, yeah, something to definitely see someone about for in terms of, yeah, thinking of prolapses and that sort of thing.
Yeah, so I guess if we're talking about prolapses and red flags, what kind of things should we be looking out for?
Yeah, really good question because it's definitely something that is not talked about enough. I have so many patients that I'll see at 6 to 8 weeks, and I'll ask them about these symptoms and they've never heard of the term prolapse before.
Mm.
They don't know what it means. Like there's, yeah, very, yeah, not as much education around that diagnosis. And I
Yeah.
think, yeah, those red flags of that heaviness that is long lasting up to that 6 weeks and beyond, can sometimes feel like you're sitting on a ball sensation, or like a tampon out of place sensation is a big one, um, as well as having like everyone is always scared to look at their vagina after giving birth,
Yeah.
but I always say, it's really important, get a mirror out, have a look, and if they, yeah, is this new bulge there that we've never noticed before, along with those symptoms, then yeah, that's sort of like I guess, our sort of first red flag questions that we're asking in our first appointment as well.
Yeah, and if we have had any sort of scarring or tearing or a cesarean, are there any sort of extra things that we need to be a little bit careful of?
Yeah, yeah, definitely. Yeah, definitely looking out for red flags of making sure that there's no infection developing in that first sort of, yeah, 4 6 weeks postpartum. Things like, any increase in redness. Uh, it's not getting better in terms of the perineal scar, like, no, still really painful to sit on after that 6 weeks. More swelling, some new bleeding that wasn't there
Mm.
before. Any sort of other sort of discharge, obviously, is a red flag. And then if it goes systemically, so, if we're getting fevers, and it's, yeah, turning into an actual
Yeah.
infection, then that's sort of, yeah, your big sign of, things that, yeah, you want to definitely seek help for straight away.
Yeah, okay. And I guess, if we've passed those first few weeks and there's no big red flags that have come up, what's actually going to help our long-term recovery? What should we be doing?
Yeah, really, really good question. I definitely really encourage everyone to start sort of their diaphragmatic, sort of 360-degree breathing that will,
Hmm.
often go through if, patients, if I've been seeing them before they go off to give birth, or through like our EMLI program, for example, where, yeah, we really cover that in our foundations,
Yeah.
learning how to breathe into our diaphragm, into our
Yeah.
bottom ribs, doing that from day one, lying down, sitting, whilst you're feeding. Just, yeah, I always say we can't sort of deep breathe enough, and the importance that that plays on our pelvic floor with our diaphragm and how they sort of move together,
Hmm.
is, yeah, I feel like one of the most crucial things. Because then if we can get that down pat as our sort of first stage, we can then go into, pelvic floor retraining.
Mm.
But we really need that diaphragm to work with our pelvic floor and have this awareness of our pelvic floor, lengthening with the inhale, and then sort of rising back up with the exhale, and then using that sort of day to day. If we're going to pick up,
Yeah.
say we're picking up your toddler, obviously, ideally you don't have to, but just that sort of, yeah, like using your breath and not holding your breath for that. Same on the toilet. And yeah, sort of any sort of exertion, we really go through that. Yeah, I feel like the breathing is our priority in those first few weeks.
Yeah, and I feel like that can be really counterintuitive. I know when you first went through that with me, I was like, oh, but I think I'm doing it the other way around.
I know, so
And
true.
you
Like
really
you
have
think,
to
you know, that
concentrate.
yeah, yeah, no, definitely. Like you, I think the natural instinct is to, yeah, hold your breath, especially
Mm,
that early, first few weeks where everything's quite painful. And yeah, it is our tendency to just sort of grip our abs, brace, hold our breath
yeah,
before doing something that we think, is going to be a lot in our body. And yeah, it's yeah, definitely trying to retrain that is really important.
yeah. And I guess beyond breathing, if we're talking about our pelvic floor, what should we be doing, I guess, in say week 1 versus week 6? So are they going to look the same, or should we be feeling a bit of a difference by that point?
Yeah, yeah, no, definitely. Yeah, definitely that first week, we're focusing on breathing, focusing on reconnecting with our pelvic floor's natural movement with our breath. We can do some really gentle, it's just like turning on our deep core with our breath, isolating that sitting, standing, lying down. And then we sort of build on that each week in terms of, adding in some double leg bridges, some really gentle, heel
Mm,
slides, a lot of stuff like on our back, some body weight squats. And then we're progressing on that week to week to make it more sort of single leg, working on, sort of like our stability and our, glute strength and being able to do stairs comfortably.
yeah.
Um, and then sort of getting into like our upper body as well, which is obviously really important as we have this baby that sort of becomes a
Pulling us
progressive
forward.
overload weight over
Yeah.
over the coming weeks and months. And I guess with all this, and we go through this in the program, I think we do it quite well, is that we, also incorporating a lot of mobility, sort of with our mid back, our lower back,
Mm,
our neck and shoulders, because it is such like a crazy period where all of a sudden, everything we do is so forward and down.
yeah.
And I feel like we can really prepare for that in those early weeks, can,
Yeah.
really make a massive difference in our recovery for that first sort of, at least like 6 months, I reckon.
Yeah, yeah, no, I agree. So important because you get so hunched over, especially if you're breastfeeding, but even just holding a baby, yeah,
Yeah,
often
I
your
know.
whole back. Um, and I suppose often I hear, oh, but it's all just about rest. And I think, obviously that is important, but what does rest actually mean? I don't think it's probably just lying down with your baby. You can't
Yeah.
really do that the whole time. What do we mean by rest?
I think that a really big thing, obviously, everyone says, rest, don't lift anything heavier than your baby, which, in practice is really difficult and, yeah, obviously not possible for everyone. I do think, like more of that sort of, active rest where, we're breathing, we're practicing like intentional turning on that core with our breath, spending 10 minutes a day, a little bit of mobility in that early, that early stage. And then when it comes to sort of, you've got your new pram, you're ready to get out there and start walking.
Yeah,
There's, sort of that whole, going through almost like a week 1 to 6 of just progressing your walking in a really sort of like gradual way. But, we're starting with weeks 1 to 2, sort of 10 minutes a day, and sort of building on that up to sort of 45 minutes a day by week 6. I think it's like a really nice sort of little goal where we're not, sort of got something that we can work towards. Um, and then within that, sort of having like almost pelvic floor rest where, say it is we're up to 20 minutes a day, but instead of walking in one go, we can always break that up into sort of two,
yeah,
a 10-minute morning walk, a 10-minute afternoon walk, with some mobility and a little bit of sort of, 10 minutes of gentle core and sort of glute strengthening in the day there as well. but so it's
Yeah.
only half an hour over the day. But yeah, I think that's really important
Yeah.
in that early stage.
Yeah. And I think that's really practical when you've got a newborn as well, because you can kind of fit it around all the other things that you're doing at the time.
Yeah, yeah, so true. Not having that pressure that you have to be walking an hour a day. But yeah, any movement is good movement, I reckon, in that early stage. And then I guess having a program that you can follow can really help to sort of guide that without feeling overwhelmed or like you're not doing enough, um, or you're
Mm,
doing too much. Like just having that nice little sort of moderation is really key.
yeah. Yeah. And talking about doing too much, I know often there's this pressure to sort of bounce back really quickly and get back to doing, the same intensity of activity that we were doing before. What are some of the common mistakes that you see mums doing in clinic?
I think that obviously doing too much, especially if it's your second or third baby, and obviously not sort of feeling like you have to be a certain weight or look a certain way by your 6 weeks. That 6 week point. I feel like that everyone has this 6 week time frame going
Yeah.
on. And you go to the GP at 6 weeks, you get your checkup, and it's often quite like an underwhelming experience in that
Mm,
you think you're going to be clear to do everything. You're going to have
yeah.
this like really clear guidelines on what you can and can't do. Um, and the reality is that like that just doesn't happen. And then I feel like a lot of mums are left more confused than before.
Mm,
And maybe they'll start going straight back to running, thinking, they've cleared me, they haven't said anything's wrong. And I think that's often where we see, mums at sort of that 12 to 20-week mark postpartum, where things start, maybe symptoms start showing because they've had no guidance, and they've gone back to things really quickly after that 6 weeks.
yeah. Yeah. That was me. And then I suffered
Yep.
so badly. For so long afterwards. It is something that I think is so common. And especially as we already discussed, that pelvic floor starts to feel a little bit better. And so you do feel like you can kind of get back to running or, more high intensity things. But yeah, that definitely can cause lots of problems. Um, are there things that you see that women are doing where they think they're helping themselves, but it's actually probably not?
That is a really good question. Probably, I think women that go into maybe doing, so what we're talking about, too much too soon, but specifically around, thinking, oh, I need to really work on my pelvic floor strength straight away. So they're,
Mm,
not really having much guidance, thinking they're, contracting their pelvic floor and doing it, at the traffic lights and at, um, random times in the day without that sort of like mindfulness with our sort of core and our breath and everything that we talk about and teach. Um, and then they're going back to really quickly like sort of really heavier abdominal work that we probably wouldn't start on initially. And I think with that obviously comes problems with if they've got like a diastasis or like that ab separation, they've got low back pain, their tailbone pain, or that heaviness is still there, and they're thinking I can exercise my way out of it. Um, without any sort of like, clear guidelines, or anything. So I think it's just that too much too soon, is a really big factor that we often see in the
mm.
clinic as well.
And when we say too much too soon, what specifically is that? Like, are there particular exercises that we definitely shouldn't be doing in those first, 6 to 12 weeks?
I think that we see a lot of runners, and just going
Mm,
back to maybe what you were doing, if especially if you're running during pregnancy, which is we're seeing more of, which is really great. But just sort of jumping straight back into your same training pace, amount of runs per week that you were doing before, at that 6 week mark is something that is really common, and that we see a lot of, that I would say, yes, considered that, a little bit too much. We do have like a good return to run guidelines now that we can follow and that we can tick off everything to make sure we're ready to start that next step.
Yeah.
And then going into like a walk run program first, I think, is really important. And yeah, definitely, yeah, it's the one, mums, you go back straight to your 5K in 30
Mm,
minutes is, yeah, I'd say that, on that side of doing a little bit too much straight away.
mm,
And then, yeah, all like our sort of, going back to lifting really heavy weights, without sort of peeling it back and getting back to our basics and re-engaging and re-having that, awareness of our pelvic floor and all our muscles around our hips and pelvis, and sort of, yeah, like re-strengthening them with our body postpartum. Um, and yeah, the other things of um, your, just your heavy ab stuff. So going straight back into, your planks, your sit ups, your Russian twist, things that, people you'd see doing at the gym all the time.
mm.
But yeah, I guess without having an assessment or, sort of any sort of, no one's guiding you, which is really hard as well.
Yeah. And if we're talking about assessments, I guess, when would you recommend that women see a women's health physio and have those assessments?
Yeah. The obviously that sort of 6 week mark is a nice, yeah, so I guess guideline to follow. I do see women a bit earlier, and that's sort of 4 to 6 weeks. And then obviously we can do like an internal pelvic floor assessment from that 6 week mark, where we will assess for any sort of prolapse, check the coordination, the strength, the endurance of the pelvic floor. Is there some pelvic floor tension there that we need to work through first? And yeah, is there, any diastasis or ab separation? Looking at how the scar's healing. Yeah, we can do it. Yeah, obviously before that 6 weeks without the
Mm,
internal pelvic floor, and then we can add that in at the 6 weeks. But yeah, there's a lot we can do in that first appointment.
yeah. Yeah. Awesome. And I suppose, I think that it is really important once you've had that assessment to continue having follow up if you need to. But do you think it is something that women, need to, I guess, come back time and time again if there's no problems, or is it that we can sort of work on a nice exercise program and go from there?
Yeah, I think obviously, yeah, that first appointment, 6 weeks, really important, 4 to 6 weeks. And then, if everything's looking okay, I'd normally encourage, maybe at sort of that like maybe 8, 10, 12 week mark, sort of 1 or 2 appointments in that next 6 week window. If there's
Mm,
nothing, nothing that's coming up in that first 6 weeks. And then from that 12 week mark, same as everything's looking okay, and yeah, we've got a really good program that we're following, with some sort of progressive overload, with some, adaptations if symptoms of any sort do come on, that can sort of, direct women into if they need to see someone, if that's your normal versus common. Yeah, I think after that sort of 12 week mark, if everything's okay and they've got, something to follow, I feel like that's like a really good, you know, next stepping stone for that sort of next up to that sort of 6 months postpartum. Yeah.
yeah, yeah. Because I think it does sometimes take months to really rebuild that strength again.
Yeah, yeah, definitely. If you think with any muscle group or any sort of strength training, that sort of 12 weeks is like our, big sort of time frame. So yeah, you can imagine that plus on top of 9 months pregnancy, your body's changed a lot. Yeah, I feel like definitely that, yeah, initial 12 weeks is our most important, where we can get a few appointments in and really set women up for a really good first year postpartum.
Yeah, awesome. And if there was only one thing that you wanted women to remember about their early postpartum period, what would that be?
Oh, it's a really good question. I think like you just, really have to be mindful of all the changes that your body's going through. Um, everyone's journey is so different. And yeah, you can't compare to your friend, your sister, anyone else around, postpartum journey. Um, yeah, everyone's experience has completely different symptoms. What may affect one person might, not affect another. And yeah, just like not being too hard on yourself. There's a lot going on,
Yeah.
and yeah, you can always seek help for things that are in that normal, but or sorry, in that sort of like common, but not normal basket as well.
Mm. Yeah. Yeah, no, I think that's a really important point to make that yeah, things can be common but not normal, and it's really important to reach out for help if that happens. Absolutely.
Yeah, yeah, definitely.
All right. Well, thank you so much for sharing your time and your knowledge. Is there anything you wish I'd asked you that I haven't?
Um, That is a good question. I guess there's a whole other topic of recovering from like a C-section, um, and even I guess like things that we can maybe add into our 6 week window that can help with our healing, as well.
Yeah, I guess what are those things that we could add in that can help with our healing?
I definitely think like that, at the hospital, having like a peri bottle is really
Hmm.
important, like that really early. Our first toileting times postpartum are going to be a little bit scary.
Mm,
So, yeah, having things that can make that less scary can be really helpful. So, yeah, like a peri bottle, I find is, something that we recommend every woman to either take to the hospital, make sure the hospital's got one, or have one at home for those at least first sort of 2, 3 weeks when everything's healing. Um, a squatty potty within this same topic, or some sort of stool that you can have at home to put your feet up on,
yeah.
when you're opening your bowels. I feel like is something that once you start using, you won't be able to never
Yeah,
not use again.
absolutely.
um, and some sort of like compression wear I think is really important and can make a really big difference in that, those first sort of like 10 to 12 weeks. We recommend like an Australian brand of like compression garments, like the like with the bike shorts that come up to sort of like bottom of your rib cage for any sort of ab separation. And a lot of them have that really important like sort of compression around the perineum that can help with
Mm,
swelling, help sort of like re-engage pelvic floor and sort of have that bit more awareness of that lift again.
yeah.
And I find that they can really help with that, that initial sort of 12 weeks as well.
Yeah, absolutely. I could not have lived without my compression garments. Having them off, I just felt so unsafe.
I can imagine, especially, post C-section. Um, just like
Yeah,
feeling like you've got something that is doing
holding you
something
back
on your
together.
abdominal wall. Can really make
Absolutely.
a massive difference.
Yeah. Well, thank you so much, Ali. It's been so great to talk to you. Your expertise is invaluable, and it's something that so many women don't get told about or that we don't talk about. And I think it's so great that there are people like you out there who are trying to spread the word. So thank you.
Oh, thanks, Amy. Anytime.